Periodontal pathogen can cause stomach cancer. Hello and greetings everyone. This is Mohan from Dental Lifeline blogger. Actually, I was literally shocked to see this fact and I just want to share with you guys. That is, a periodontal pathogen, that is a gum disease causing pathogen, can cause stomach cancer. Actually, they say that periodontitis can cause stomach cancer. So first I would say about what is periodontitis. Periodontitis is usually caused due to poor oral hygiene. That is, after we brush, the pellicle gets adhered, and then due to the poor oral hygiene, there is more accumulation of plaque and calculus, along with the bacteria gets adhered along with the tooth. So, in gingivitis, we can see gingival irritation, reddening of gingiva, swelling of gingiva, and also bleeding. But in periodontitis, the calculus deposition in supragingival and subgingival levels may cause the clinical attachment level of gingiva to go down, and thus it may lead to a condition called recession. That is, the gingival level gets reduced from the tooth level, and it may also cause mobility due to the circumferential loss of the gingival tissue, and then it may also cause furcation involvement in the posterior teeth, and eventually it may lead to the loss of teeth in our oral cavity. So it is a very bad condition that we call it as periodontitis. So in this video I am going to say how this periodontitis causing bacteria, that is a particular bacteria is present in this sector, which may cause stomach cancer also. So we could know that how sensitive this topic is. So come on, I'm going to explain it about in detail. First, let me tell you the causative organism for this stomach cancer. It is called as Treponema denticola. Actually, it belongs to the red complex, which comprises of Aggregatibacter actinomycetum comitans, Tenerella forsythia, and Treponema denticola. So it is a very important bacteria to be noted in periodontitis sector. Actually, the British Journal of Cancer has given this fact that this Treponema denticola can also cause stomach cancer. Let us see how. So first, from the oral cavity, if this Treponema denticola gets moved to our bowel through the saliva, or when we consume a food with a poor oral hygiene, this Treponema denticola, if it moves to the bowel, it may cause some changes. That is, it may give the chymotrypsin-like proteinase. That enzyme or that factor may activate the pro-MMP8 and MMP9, that is matrix metalloproteinases 8 and matrix metalloproteinases 9. So these factors are very important factors, that is MMP8 and MMP9 are very important for carcinogenesis. First, let us see what is a chymotrypsin-like proteinase. That is a virulence factor. I will just explain what is a virulence factor. The virulence factor may act against the host, and it may also cause some serious damages or serious changes. The main concept is it can act against the host and it may cause some bad changes or worse changes. So that is a virulence factor, we call it as such. And the chymotrypsin-like proteinase may activate the pro-MMP8 and MMP9. The MMP8 is involved in the degradation of type 2 collagen, and MMP9 will be seen in the poor prognosis and in the metastasis of a cancer to many other places, many other regions, like we call pancreas and we call colon, rectal, or we can also see it in other than stomach, we can see it in tongue or esophagus. Like that, in many areas we can see it as such. So these two factors are very important in causing the carcinogenesis. Additionally, the tissue inhibitors of metalloproteinases, that is we call it as TIMs, they are involved in the inhibitory activity of MMPs. In this scenario, two TIMs are involved, that is TIMP1 and TIMP2. The TIMP1 is usually involved in the inhibitory activity of MMP. So it can inhibit the progression of MMP's process, but it has other phase. It can also promote the tumor progression, angiogenesis. It can inhibit apoptosis, and it is also seen in poor survival scenarios. And the TIMP2 is usually involved in the inhibitory activity of MMP2 specifically, but the Treponema denticola chymotrypsin-like proteinase will deactivate or inhibit, or it will not allow these TIMPs to process or to work against the MMPs. So it contributes to the carcinogenesis development in our body. So this is a very important scenario which is happening, and other two factors are there: alpha 1 anti-chymotrypsin and C1q. So C1q is a very important factor, and it also causes cancer addition, migration, proliferation in vitro in our body. So overall, this fact says that this periodontal pathogen has the ability to cause stomach cancer. As a dentist, my advice is, please maintain a good oral hygiene. Please do give a regular dental checkup. In this scenario, we can't do it, but as a general advice, please do take care of your oral health as well. So when these facts are coming to our knowledge, we feel so bad and we feel so frightened that we should do our utmost work, or we should provide awareness among the people about this scenario, and we should take care of our society as well. So that's it for today. Hope you guys like this video. Please give your comments in the comment section, and please give your suggestions for your future topics as well. So have a nice day. Take care. Bye.